Is COVID-19 still a global health emergency of international concern? The World Health Organization's Emergency Committee meeting Friday to decide if the UN agency's highest level of alert should stay in place or be scrapped.
It can't be an emergency forever.
But that doesn't mean COVID is going away anytime soon, says Dr. Zane Shagla, an infectious diseases specialist at St. Joseph's Healthcare Hamilton.
It's still an international medical issue. It's an international epidemic. It really just means, the Public Health Agency of Canada, provinces really are the ones in charge of COVID policy. And it's really been like that for some time.
Nearly 3 years ago to the day, the WHO got the world's attention with this grim announcement.
I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
Since then, a staggering 664 million plus cases have been recorded globally. COVID deaths have topped 6.7 million. The real totals, though, are believed to be much higher. So far, Canada has confirmed more than 50,000 COVID fatalities. A possible hint from the WHO this week that it may be too early to end the emergency phase. Not only is the situation in China still worrying, but deaths worldwide are on the rise.
In the past 8 weeks, more than 170,000 people have died of COVID-19. That's just reported as.
And Shagla says dropping the emergency status does come with concerns.
People do need to still consider data sharing, information sharing, technology sharing, vaccine sharing, therapeutic sharing as part of the long-term strategy of control. And it can be very easy for countries to start just focusing on their own populations.
Welcome to our first update of 2023.
Ahead of the WHO's committee meeting, Canada's chief public health officer was asked last week about the impact a global COVID status change could have here at home.
We just need to keep going with what we're doing now. We mustn't, I think, let go of the gains that we've had in the last several years, including surveillance systems, the antiviral developments. You've got to monitor those in case the virus escapes the effectiveness. And we mustn't reduce the research investments.
Dr. Teresa Tam says that includes keeping up research into long COVID. As for the WHO's decision, the final call, that's up to the group's director general. And he's expected to make an announcement on COVID's threat level next week. Melissa Duggan, City News.